So, croeso pawb, croeso I dydd Gwyl Dewi hapus I ti, Cles Smith ydw i. Rydw i wedi bod yn gweithio yn y gweithlu mewn iechyd y lles y gweithlu nawr am 7 mlynedd ac yn yr NHS am 20 mlynedd. So welcome everyone, happy St David's Day. My name is Cles Smith and I've been working in colleague health and wellbeing now for the past 7 years and for over 20 years in NHS Wales. It's great to be here today and I really value the opportunity to come and highlight this really important work. I'm joined today with 2 of my colleagues from the NHS Wales Health and Wellbeing Network. So I have Carolyn and Claire with me who will be helping to facilitate during the breakout rooms later in the hour. So thank you very much, and if we could just move on to slide number 2. So to begin with, I just wanted to touch on the evidence, and that is, why is staff health and wellbeing so important? So, and it's not just important for staff, it's also important for our patients. So over the last 10 years, there's been growing credible evidence of the importance of staff health and wellbeing. And it's not just about the health of the individuals, it's also about the health of the system as a whole. So the key to wellbeing is engagement. And engagement is closely linked to the individual's relationship with their organisation and, more importantly, with their team and their line manager. Engagement and well-being are interconnected, and these factors are positively correlated with a number of highly desirable organisational outcomes. So these links are now well and credibly evidenced, even though we can still struggle to see them. So some of the evidence is pointing, and there's some links on the slide there. If you wanted reflector and you wanted to read up a little bit more about it, there's some links there. But basically what it's saying is that staff's view of their leaders, be it positive or negative, there's a correlation with the patient's view of the quality of care they received. Similarly with staff satisfaction and patient satisfaction. We've also found that working in high pressure area results in less compassionate care, privacy and respect for the patient. And poor staff well-being actually has a financial cost to the organisation, not just quality, it also has a cost. And similarly, good HR practices, so personnel HR workforce practices, actually result in lower patient mortality. So there is a real reason why we need to look after the well-being of ourselves, our teams and our staff. So next slide, please. So key to creating the conditions that are laid out in the Healthier Wales plan is for organisations to understand that link, the link between employee wellbeing and engagement, and to understand that we work in a very complex health and care system. It's not straightforward, it's not black or white, it's not healthy or unhealthy, it's not linear, it's all about the relationship. So the individual, the manager, the peers, the team, the overall department and the job, all of which impact on staff health and wellbeing. And I've just put in there Maslow's hierarchy of needs to just demonstrate that it's a pyramid. And what he explains is that for us to be the best that we can be at the top, which is self-actualization and self-fulfillment, we actually need the building blocks beneath us, some of which of those have been severely impacted through COVID. So the importance of air, food, warmth, rest, shelter, and then safety, security safety. So we're talking like PPE and also psychological safety. And then further up, as we move up, then there's belonging and love, psychological safety within the workplace, and the interpersonal relationships that we have with our peers. And then finally at the top, this is where we have all the building blocks underneath us, which then actually result in us being the best caregivers to ourselves and to others as we can be. So next slide, please. So this is the context to which we're working in. I've actually mentioned about the Healthier Plan for Wales, but we've got a plethora of legislation, acts, policies and guidance and systems around us to support that health and well-being of the system, so not just the individual. So some of the strategies and acts are along the top. You're welcome to click on these at your own time and access those, read about those. So I think I've got some feedback. Oh, it's gone. We've also got the compassionate leadership within HAW, and there's a link there to the Gwella leadership platform. And if I can just highlight the importance of compassion and engagement to well-being, they all roll together, they all link together. We have to be compassionate to ourselves, to each other, for us to be engaged and for us to be well. We've also got a number of other approaches within Wales that support this. So we've got the healthy working relationships, and that is the respect and resolution policy, which replaced the grievance and the dignity at work. We've also got our staff survey measuring colleague experience, and we are developing a staff governance framework, which is probably not what it's going to be called, but it's basically the promise between NHS and its employees whilst employed with us. And then we've got the managing attendance at work policy, which is currently under review and has been in place now for about 3 years, that has compassion running through it. And then the most recent is our workforce strategy for health and social care, which is built on the Gwella leadership platform, compassionate leadership principles, and the managing attendance at work and the healthy working relationships. So that's the context to which we're working in, and I'm really pleased that we have this in Wales. Not every country has this. If I can move on to the next page, please. So I just wanted to tell you the story of what happened during COVID-19. So in April 2020, the Staff Health and Wellbeing subgroup, which was a subgroup of the workforce cell, which was established by Welsh Government to respond to the pandemic. This group was created at much pace, and our early priorities were to underpin the compassionate leadership principles, to review best practice from elsewhere and adopt where possible, to build on work already being undertaken with Welsh Government, such as the expansion of health for health professionals, and to explore and procure, where appropriate, priority access solutions. So the group grew very quickly. We had representation from across NHS Wales. And what was key here is that we also had members from Social Care Wales, workforce, Welsh Government and trade unions. We met regularly, and as I mentioned, we worked at pace. We were COVID focused, and we needed to support the well-being of our staff. We rapidly put in place a one-stop shop providing access to all the resources. This plan on a page is an overview of the resources that we put in place in the early stages. It started off with a playlist, and it then migrated to a website which currently exists, and I'll be giving you a tour of that later. So what we're working on now, if I could just move us on to the next slide. So before I tell you any more about what we're working on, I just wanted to ask you a question. And that was, do you know how to access or signpost to health and wellbeing support, information and resources? Well, this is looking very promising. 75% so far, no. Okay, that's great. Thank you very much. And what we're going to do at the end, we're going to compare at the end to see whether that changes following today's session. So thank you, Abby. If we could move on to the next slide. So for the 9 of you who know where to access, where would that be? So again, through Mentimeter, this is a free text now, and it'll populate a Wordle for us. And that's great. And all of those are true. All of those are right. Yes, there is all those services and options available to you, both locally and nationally. Thank you. Any surprises there for anybody? If there are, you've got more information, so that's great. That's fab. Thank you. If we could move on to the next slide now, please. Right, so yes, you're right, all those are available, and here is a slide that basically shows not all of them, but most of them that are available. And what you see on the slide is the same. I've got a couple more pyramids, but basically they all do the same thing, and that's to say that the majority of us, the bottom part, will seek and need support locally. There's an emotional and a physical decision tree which you can click on, and it will take you through a series of questions, and then the answers will signpost you. In the first instance, I always say to go to your local health board, because they know the needs of their staff the best. So if you've got an employee assistance programme, occupational health, employee wellbeing service, that's where I would signpost in the first instance. Once you've done your own, once you've gone through the emotional or decision tree, done your own search, and maybe discussed with your manager and your peers, that would be the first place. But then we have a lot of national resources available, all of which you see in front of you are free. So what we've been working on, so the NHS Health and Wellbeing Network, what we're currently working on is raising awareness of all these resources, hence why I'm here today, monitoring how these are being accessed. I'm attending national meetings with NHS England, NHS Improvement, NHS Employers, NHS Scotland to address if there's anything that they're doing over the border that we're not doing, address any gaps that we may have here. We're also piloting 2 projects. We're working with Dr. Adrian Neil, clinical psychologist and head of wellbeing services in Aneurin Bevan, and Professor Richard Williams from Cardiff Metropolitan University in the development of a peer support pilot. And we're also scoping out how the arts can support health and wellbeing of colleagues through the Arts Council of Wales developed a arts digital platform, and we've commissioned the Body Hotel Moving Respite to do a pilot in HEIW. So we're looking at more therapeutic areas of support, and we're also developing a colleague. So that would include students, volunteers. It's basically our family, NHS family. We're developing a framework which will be aligned to the social care framework as well, which will basically give a framework to what health and wellbeing offer should be in Wales and for the future. So HEIW provides programme management support to the National Staff Health and Wellbeing Programme, and we have expert membership from all the health boards and trusts in Wales, including clinical psychologists, heads of occupational health and employee wellbeing services, Welsh Government, and more recently Social Care Wales. What was key to developing this programme and these resources that we gathered together was the fact that the NHS Wales Health and Wellbeing Network and the Managing Attendance at Work project group and the former occupational health subgroup, we'd been meeting and established for about 6 years. So those relationships were already well established, and that allowed us to work as a collective across Wales very, very quickly. So the purpose of these groups is to share best practice and develop a central repository of information and guidance, increase peer support for health board trust leads in health and wellbeing, managing attendance and occupational health, reduce duplication of activities, increase sharing of successes and learning between NHS Wales and beyond, and increase access to resources and collaborative developments across organisational boundaries. So any of these resources that you can see here, I'm happy for the slides to be shared afterwards. You can click on them directly and they will take you directly to our website. I just wanted to touch on a few of these, just 3 of these before we move on. So first of all, if I can go back to the questions, the next slide, please. Okay, so what I'm going to do is I'm just going to highlight some of 3 of the resources that I mentioned earlier. So I'm going to try something now. I'm going to try and share my website, so bear with me. So this is the Colleague Health and Wellbeing website. As I mentioned, this is the national website, and it came from the playlist that we developed right at the beginning of COVID. So what that takes you through here, first of all, as I mentioned, we've got links to all the health boards trusts across NHS Wales and Social Care Wales. And if you click on that, that'll take you to your health board. And if your health board has an internet page for its employee wellbeing service, you'll be able to access that directly. These are the emotional and physical tree, which you can, decision trees, which you could, it takes you through a series of questions, which then helps signpost you to the most appropriate resource. So the ones I wanted to take you through first was Health for Health Professionals. Let me just find that. Now this is my, so Health for Health Professionals, it's free and it's been extended now to cover social care staff as well as health. It originally was for doctors, for medics, but that was extended at the beginning of COVID to all healthcare staff, regardless of whether you're on the front line or not. The service it offers is 9 to 5, Monday to Friday. It's got various self-help materials, platforms and apps. It also offers peer support, emotional support to doctors and medical students. It's got guided self-help, and it also provides, where appropriate, access up to 8 sessions of cognitive behaviour therapy with an accredited therapist. So when you phone that line, or when you either phone or you complete the self-referral, or you email, you'll first be triaged by a doctor advisor who will then be able to signpost you to the most appropriate resource. Now, where it's considered to be someone needs more urgent or higher level intervention, they're also linked into the GPs to ensure that anybody requiring access to a crisis system, they can be signposted to that. So the next one I wanted to talk about was the Samaritans. We've also got Welsh Government commissioned a dedicated health and social care line for Wales at the beginning of COVID, and that's been extended. It's bilingual. There's a Welsh line and an English line, and they're trained volunteers, especially for the health and social care workforce. That's open. So English is 7 a.m. to 11 p.m. and Welsh is 7 p.m. to 11 p.m. And then finally, I wanted to talk about Silver Cloud. I'll just go back. So Silver Cloud, this is a CBT online program, and it has various programs: anxiety. In fact, there are 5 different anxiety programs: depression, COVID, panic, phobia, and OCD. So that again is free to health and social care staff, and the link is on there on how you access it. Thank you. So I'm going to stop sharing now, and if we can go back to the slides, please. So if we go to the next slide. So what I'd like to do now is, we've all been sat at our desks through COVID, haven't we? Longer than maybe we were before. So I think it's important that we take some time during the day to move and stretch. So hopefully this will be able to work. Abby's going to click on it, and we're going to have 3 minutes of seated yoga. If you want to turn your cameras off, that's fine.
So today's video pose is seated cat-cow pose. So to begin, you want to exhale and you want to let the hips tilt where you're dropping back towards your tailbone. Let your back round, so it's like a forward bend, shoulders coming forward, head dropping. And now you're inhaling, you're coming back up, bring the weight onto your legs. Let the belly come out, up, the chest is out and up. Lengthen your spine, the head comes up, you're gazing where the ceiling and the wall meet. And I'll just do a couple of these. Dropping back, rounding the back. Inhaling, coming forward. Lengthening, putting a little back bend in. And then a forward bend. So this is a great pose for your spine. This is massaging the spine from the tailbone all the way up to your head. Finish with one more. So again, this really massages the spine front to back, from the tailbone all the way up to your head. It's a great pose. Probably the best pose out of all poses that we do.
Thank you very much. So if anybody wants to stand up and have a big stretch, please feel free. And if we can move on to the next slide. Thank you. So hopefully we'll all be a little bit more relaxed, a little bit more less sedentary. Okay, so what I just wanted to talk about now was a report called The Courage of Compassion, which was about nurses. However, what it contains, it can be generalized to all the workforce. It was for nurses and midwives, but it can be used and adapted to allied health professionals. So what it says here, and it builds on the work of Professor Michael West and links directly into the compassionate leadership principles, that for us to thrive in the workplace, we need to have 3 things: autonomy, belonging, and contribution. And these get broken down into smaller parts. And you can read this report if you're a theorist and you want to learn a little bit more about it. But it's basically saying that if we have these 3 things, which are made up of smaller themes, we will have better engagement and better well-being in the workplace, resulting in better patient outcomes. So in identifying in the report the consequences and solutions in relation to poor well-being, it looked at a number of primary interventions. And from those primary interventions, they came up with a set of recommendations. So if we could just move on to the next slide. So these are the recommendations that they've put forward. There's 8 of them, and each of them has its own section in the report, but basically it all links back to the ABCs. So the reason I wanted to highlight this to you is that the thought that you can look after yourself, which is important and is preventative, is enough. It's not. The system as a whole needs to work together to ensure that our workforce has those three components: autonomy, belonging, and contribution. So that goes from how our teams are made up, the job demands, the job design, how we have our wider networks. All of that impacts on our own health and well-being, some of which you will have influence over, and some of it you won't. So I wanted to talk now, after this, on a couple of the tools that we do have that you can use to support yourself. So if we can move on to the next slide. So these are the two tools that I advocate within NHS Wales. The conversation guide that was issued last November, and it's a collaboration of the network and Welsh Government, and it can be accessed by health and social care staff. It's accessed through ESR, through the Learning Hub, as you would do your statutory mandatory training. And there is a guide that's been put on the website today, which shows you how to do that. And it's got a few screenshots of how to get onto it. Now, it's recommended that you do that with your manager, or if you're a manager, that you do that with your reports. And it's just a tool to have a conversation about your health and well-being. Then the second one is the wellness action plans. Now, these have been updated very, very recently. So if you wanted to go onto the Mind website, you'll find now that they've increased these. They now have ones for home working, hybrid working, flexible working. So that's really good news to know that they've expanded on those. So what I've done is, if we move on to the next slide, I pinched with pride from Betsy, and Betsy Cadwaladr looked at how it could combine the HSE stress risk assessment, management standards, and the 5 ways to wellbeing and the wellness action plan all into one action plan. So this is what Betsy advocate for their managers, and it's a very useful tool that you could use. I would suggest you find out what your local health board does in the first instance, but I think having options is always a good place to be. So this takes you through a series of questions, and then on to the next slide, and then you can score yourself at the end, and that will give you a total of how you're feeling. And then on the next page, on the next slide, there's some measures there on how you can remove, reduce, and manage where you've scored higher in some of those areas. This is the manager one now, working with your manager working with you, because some of these as an individual will be out of your control as an individual. So then moving on to the next slide. So what I wanted to do is, there is an action plan that goes with that wellness action plan. And I've adapted it to incorporate the 5 ways to wellbeing. Now, the 5 ways to wellbeing is from the New Economics Foundation. It's well researched and evidenced, and you can click on that link and it'll take you to all the science behind it. But what it's basically saying is, for you to be the best version of you, you need to maximize those 5 things in your life on a daily basis. So if I could just take us into the next slide. So these are the 5 ways to wellbeing, and there's some examples here, and again, pinched with pride from Betsy. It basically gives you an example under each of the categories: connect, be active, keep learning, take notice, give. And there's examples of how you can do it at home, and there's examples of how you can do it at work. And it can be as simple or as complicated as you want it to be. For example, giving could just be a smile. You don't necessarily need to volunteer a whole day at at a homeless shelter if you want to, that's fine. But it's about giving and the importance that that has on the chemicals in your brain and how that makes you feel. So I wanted to do a bit of an exercise. I wanted to take us now into a breakout room, which will be facilitated. And what I'd like you to do in your breakout room is working through these 5 ways to well-being. There is an action plan, which is on the website, which you can populate. But really a facilitated conversation around what you could do under these 5 themes. So if that's okay, you're going to be automatically now pushed into breakout rooms for 10 minutes, and then you'll be brought back into the main room. Well, that seemed like a very, very quick 10 minutes.
It just disappeared, that. We were in mid-flow there.
I know, I was mid-sentence. Okay. Hopefully we'll have some time at the end to talk about some of what was discussed in the facilitation sessions. So thank you. And if we could move on to the next slide, please. And the next one. Okay, so we're back to the Mentimeter questions now. And it's the same question again as we had at the beginning, just to see if I've managed to impart any knowledge or information. Well, thank you. That's looking very positive. And the challenge to me, from me now to you, is to go forth and share that knowledge and information with colleagues, those that couldn't be here today. Okay, thank you very much. If we move on to the next slide. So, another Mentimeter question. What do you think is NHS Wales' priority for colleague health and wellbeing? I know we're all different, and we've got so many different professions and we're located all across Wales, but if there was one thing that we should be concentrating on. Oh yes, all of those would be fab, wouldn't they? Yeah, sustain the support. I think that's so important. It's nice to see happy and enjoying your job. Longevity. Oh, that's great. Thank you, everyone. Thank you for that. And then just one last Mentimeter question. So what are you going to do? What's your promise to yourself? Even the smallest step. Yes. All of these are a challenge. If they were easy, we'd all be doing them, wouldn't we? They're simple, they're just not easy. Self-compassion is so important for one's own health and well-being. Breaks, it's really important to take your breaks, to hydrate, to move, to have some time away. So have a think about these things now that you've written here and how you can build those in. Maybe have an accountability buddy, or think about how you can plan them in. Because if they're planned in, they're more likely to happen. You've got the 5 ways to wellbeing sheets on the web page and the template. If you wanted to fill that in your own time and maybe share it with colleagues, with teams. Don't rush personal conversations. They've gone, haven't they, since we've been they've gone in my world anyway since I've been virtual. It's like, those chats in the hallway are so important. Make more time for the people I love. I know. Some really, really good promises to yourselves coming up there. Thank you. So if we can go back now to the next slide. What I'd like us to do before we finish is just to take some time. And all we've got to do, we've been doing it since the second we were born, or maybe a few seconds after we were born, is to breathe.
There are times when we all experience feelings of stress or anxiety. In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier.
Thank you. I mean, obviously that was an American video, so YouTube, so don't call that number. It won't work here. But you can access the resources on the website. So if we can go on to the next slide. So I just wanted to highlight, I wanted to say thank you for your time and your contribution today. Diolch yn fawr, pawb. There's a link there to the website which I showed you, and then there are two key documents there that were developed by the network, Our Wellbeing Matters and Manager Wellbeing Matters, and they both contain very useful signposting for oneself and if you're a manager, to support you and to support you being a manager to support your staff. There's also a dedicated national email address at the bottom as well. So if you wanted to email directly about anything national, you can. But in the first instance, I would always signpost you to your local health board's employee wellbeing pages. Thank you. So I think we've got 2 minutes left. I wasn't able to see any of the questions in the chat. Wendy, I think Wendy, you've got your hand up.
Yeah, there was one question that came through about access to some of the resources for healthcare students.
Right, so in the first instance, students wellbeing support should come from the education provider. So it's the health education institution where you work. However, some of the health boards do support students on placement through occupational health and their employee wellbeing service. Some of the resources are just staff-based, but on the website, the majority of the website are free open access resources to anyone.
And the other question was around sharing the slides so that people have got all of the links and resources so that they can share them widely. So we can do that. We can make sure that everybody who's on the call today receives a copy of the slides if that's what if you're happy for us to do that, Claire.
Yes, very happy for you to do that. Or everything I've linked to is on the website or in the slides.
Perfect. Thank you.
Just wanted to say thank you very much to my facilitators. And thank you for this opportunity, and thank you for coming.
Thank you, Claire. That's a cracking session.